Hi, this video is the art of hair transplant restoration surgery on a client who has a thinning from the front all the way toward the back. He still has some frontal fallout, but it's very weak, and we know that it's on the way out. And so instead of waiting until he completely bald and get something done, the patient opt to have some surgery right now. But when you wait until you're completely bald, then people know you have had surgery. So this is some time with some hair, when you fill it in and blend it in with existing hair, it's more subtle and less detectability. Hair transplant, unlike most of my work, it's an art form. It requires a lot of the artistic and aesthetic detail to ensure very natural results. The great thing about his hairline is it's still there, and we're just trying to zigzag the way through. Here's a little widow's peak, so we keep it where it is, and on the right hand side too. So, and we work from the front all the way to the back. We anticipate around 4,500 grafts. Could be more. The bigger the head, the more surface area to cover, then the more hair we'll need to cover. As of this moment, you look around 45, or could be 5,000, depending on how much hair we need to fill in. From the hairline toward the middle, it's a minimum of around 2,500 grafts to 3,000, and from the middle toward the back, sometime you can get it with 2,000 or 2,500. Hair transplant, as I mentioned on many videos, is not a perfect procedure. Sometimes you're gonna need more than one surgery to have perfect density. But with my work, and with the more hair you put in, the less likely you have to come back. And if you're a perfectionist, then you probably might need a second procedure just to increase the density and have it, as dense as you want it. But a lot of times you can get away with one too, of course. So on average, from the eyebrow to the hairline for Asians, around 6.5 to 7 centimeter. Same thing as black men. Caucasians, from the mid eyebrow to the hairline, is around 7.5 to 8.5. And then once we get the height in place, we build the hairline according to the facial structure. The more narrow the face, the more arch back the hairline. The more round the face, the more flat the hairline. So his is somewhere in between. So that's why his hairline is a little bit not as arch up as other narrow face, but not as flat as other more round face. So it's somewhere in the middle. And the great thing is his widow's peak, so we just keep it the way it is. My goal is not to change how he is. Once we get the shape down, we transplant at a 45-degree angle, 35-45. Increases when you go backward and changes when you go different direction. It gets steeper when you go backward. Not only is the selection of hair, the angle is important, the selection of hair grafts is important. We transplant rows and rows of single hair graft in the front, followed by 2 hair, 3 hair, and 4 hair in the back for bulk and volume. So this is the art of hair transplant restoration surgery on a client with a thinning from the front all the way toward the back. And I'm just going to show the audience what it looks like all the way here. You can see it's all here. I'm very excited for him because by next year it will completely transform his look. It will look, once you have a full set of hair and lower hairline, it will make him look younger, gaining 10 to 20 years of his youth back. Not only his youth, but when you have lower hairline, it frames the face, and it really enhances the eyes, the nose, and all the features that God created for you. So this is the art of hair transplant. We're gonna be filming now, and hopefully he can come back. We're gonna do another post follow-up a year later for a follow-up video. Thank you.